we are going to be discussing Welcome back to my YouTube channel. Today we are going to be discussing G.E.R.D, which is gastroesophageal reflux disease. Now, what is G.E.R.D? G.E.R.D. G.E.R.D is a prolonged exposure of the gastric esophageal mucosa to gastric content, and this prolonged exposure will lead to esophagitis and heartburn. Prolonged exposure of esophageal mucosa to gastric content, and this will eventually lead to esophagitis, and heartburn. G.E.R.D. So now, what are the causes of this disease, G.E.R.D? The causes, let me see etiology of G.E.R.D. We have things like obesity. We have diet. In the case of people that are used to taking large meals, fats, chocolates, coffee and alcohol. And also there is hernia, hiatus hernia, patient with hiatus hernia, and there is increased intra-abdominal pressure, that is like for example, in people who are pregnant moms, and also people who wear tight clothes, also in obesity too. All leads to increased intra-abdominal pressure. And we have delayed gastric emptying too. This also is a cause of G.E.R.D. And we have defective esophageal clearance. So defective esophageal clearance happens when there is poor esophageal peristalsis, and this will also lead to delayed acid clearance, leading to increased esophageal acid exposure. Increase esophageal acid exposure time. And we have also, in cases of abnormal lower esophageal sphincter. So this is in a situation whereby the tone of the sphincter has decreased tone, or there is abnormal relaxation. Usually the sphincter is always contracted, unless if a person is going to swallow during swallowing. So the sphincter will relax and then you swallow and it go back to its contraction phase. So when there is abnormal relaxation, this will lead to G.E.R.D too. Now these are the causes of G.E.R.D, gastroesophageal reflux. And now let's see how a patient presents to the hospital, or what are the clinical features in a patient with this disease. Clinical features. So number one, we have the most common ones are heartburn and regurgitation. Heartburn and regurgitation, these are the most common ones. And this heartburn usually it is felt behind the sternum, and it also radiates to the throat or esophagus. And usually happens after meal. In both cases, that is in both heartburn and regurgitation, there are situations whereby the pain is aggravated and there are situations whereby the pain is relieved. Now the aggravating factors are So now these aggravating factors are: number one, we have bending. When you bend, especially after meal, and lifting objects. We also have straining. We also have lying down, especially after meal. And now, what are these relieving factors? Relieving factors These relieving factors include sitting up. So definitely lying down aggravates, so sitting up will relieve. Sitting up relief. Antacid, always there to help. Antacids. And also walking around. Especially after meal. So now, what are the other symptoms of the other clinical features of G.E.R.D after heartburn and regurgitation? We also have water brush. So water brush is a situation whereby there is increased salivation when the acid reaches the esophagus. It's a kind of protective action in order to dilute the acid to prevent its side effects. Like I say, salivation that happens due to reflux, salivary gland stimulation, as acid reaches the gullet or esophagus. kind of projective action. And also, so the next symptom, we have patients having odynophagia. Odynophagia, which means painful swallowing, and also dysphagia, which is inability or difficulty swallowing. Let's use difficulties more appropriate. Difficulty swallowing. And also we have hoarseness of the voice, hoarseness of the voice, and finally atypical chest pain. Atypical chest pain. Now, what are the complications of G.E.R.D? Complications of G.E.R.D include: number one, we have esophagitis, we have anemia, we also have gastric volvulus, we have aspiration, and we also have Barrett esophagus. Which is a pre-malignant disease. Malignant disease because there is alteration in the cells. Now, how do we investigate a patient with this disease, which is G.E.R.D? Investigations. So for investigations, number one, mainly the most important thing is you do clinical diagnosis, as mainly history. And if the patient is less than 50 years of age, there is no need for medication. There is no need for investigation, sorry. No need for investigation. Just do empirical therapy. So, and in patients that are older, you do 24 hours intraluminal pH monitoring. And and you can do manometry. What was I thinking about? Okay. And then you can do also barium swallow, and you can do esophagoscopy. So this investigation, mainly you do history and examination the patient, and you don't need to do investigation if the patient is less than 50 years of age and the patient is not having any alarming symptom. And if the patient is having alarming symptom and is more than 50 years of age, you do 24 hours intraluminal pH monitoring, you do manometry, you do barium swallow, you do esophagoscopy. And what are these alarming symptoms? These alarming symptoms include anemia, dysphagia, anorexia, weight loss, melena, and hematemesis. Okay, now how can we manage this patient? Treatment. It's in 3 ways. There is general, we have medical, and finally surgery. So general, medical, and surgery. Now let's take the general and see. Okay, the general, you are to avoid all the mentioned etiological causes area, the avoidable ones, and you prevent yourself from the rest. So avoidance, like you correct your diet, and if you are obese you exercise and rest. So this includes things like weight reduction, as in the case of obese patients, and we also have stop smoking if the patient is smoking, and meals should be small frequent instead of large meal at once. Small frequent meals. For example, if the patient is taking like 3 meals, he'll make it 6, but in small amounts, unlike before. And don't lie down immediately after food intake. Avoid coffee, chocolate, tea. So all in all, it's going to be modification of lifestyle modification. So now, what are the medical causes? The medical causes of the medical treatment of G.E.R.D includes: number 1, you give antacids, and you give proton pump inhibitors. Also, you give also H2 receptor antagonists. And if there is no response, you go for what? pH monitoring. If this pH monitoring is positive, then you go into what? Surgery immediately after this. Surgery. When it is positive, you do surgery. And when this is negative, you reconsider your diagnosis. Consider your diagnosis. And so the surgery is known as fundoplication. This is a process whereby the lower esophageal sphincter is taken back into the abdomen. So this is a situation whereby the lower esophageal sphincter is returned back into the abdomen by wrapping it with the gastric fundus around the esophagus. And we can also do H. pylori. Lastly, we can do also H. pylori eradication in patients that require long-term medications, and also in patients that are positive for H. pylori too. So now let's see the sequence of this treatment. First, you start with what? Antacids. And then you give PPIs. PPI, H2 receptor blockers, and also in some, if there is long-term medication or positive, you do H. pylori eradication. Still, if there is no response, you go to surgery. That is, you do fundoplication. And this brings us to the end of today's lecture, which is G.E.R.D, gastroesophageal reflux. Thank you. Subscribe kindly, share, comment, like. Yes, as usual, we are happy. Doctor, da 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 da.